Good morning and salam sejahtera. Thank you, Mr. Andrew, for the kind introduction. And this is my fourth time attending a Malaysian pharmaceutical pharmacy meeting, and it's always a pleasure to listen and to look around from the pharmacist perspective point of view. So my task for the next 20 minutes or so is to discuss about how to choose the probiotics appropriately, or the right probiotics in the practice. So this is the outline of presentations. A little bit about gut microbiome, what is a dysbiosis, a healthy gut, and what are the probiotics that we should supply to our healthcare customers, not only patients, and of course choosing the right probiotics. And I think if we do some reflection, if we trust the properties, I mean, for the last couple of decades or so, we're getting to know that many diseases actually begins in the gut, from brain to toes really. Even from Parkinson's disease, a lot of data to show that the diseases actually begins when there is a complexity of the gut microbiome is altered and causing a lot of diseases. And of course, without any data, me and you just another person with an opinion. So what is a microbiome or microbiota? It's actually a collection of various microorganisms, from bacteria, viruses, fungi, and protozoa, so and so. It's actually our little people, little individuals or little species, as you like, residing in the gastrointestinal tract, from the mouth to anus, from the upper, from the middle, and from the lower GI tract. And as we know that the acidity of the digestive tract become reduced from the upper part in the stomach, for example, pH about 1 to 2 or so, and from the lower down, the pH will be increased. And some diseases, GI tract tend to be very acidic, and probiotics, whoever took it, can be not relevant. Now this is a slide, for example, very important over the lifetime when we were born, whatever, many years ago. Over the time, we are predisposed to many aspects. So you can see here over the time the complexity of the microbiome is reduced. And then we are exposed to inflammation, many diseases, including cancers. And of course, many other factors that contribute to the changing the population and density of microbiome, such as the way that we were born, either spontaneous vaginal delivery or cesarean section. In fact, cesarean section predisposed to very bad microbiota as opposed to vaginal delivery, the feeding, the type of processed, ultra-processed food that is taken by us, stress, of course, stress is very subjective, traffic jam, also stress, and many drugs you are very familiar that you actually dispense from the pharmacy, in particular various antibiotics given inappropriately for patients, in particular suffering from viral illness, supposed to be self-limiting disease, rather than having probiotics. Now we did the position papers a couple of years, 2-3 years ago with friends, and showing that all the factors that I've shown you very much all agreed. The factors, the time that we were born until the adulthood, there are many aspects that actually can alter the environment, including addition of probiotics impacting the gut microbiota, not only at adulthood but early life. Now, sometimes we wonder, so what's the job of the gut microbiota actually in our digestive tract? I mean, very important that it stimulate, increase the bowel motility, and the patients or the healthcare customer have a good bowel movement, support the balance of intestinal micro and microenvironment, also some degree improve the immune system, and also involving the digestions of the food, processed or ultra-processed food, and multiple nutrients that we eat every day. Now, this biosis, there is no test to show that healthcare customers have this biosis, but we know that the equilibrium of the composition of the gut microbiota is disturbed from various reasons that you can see there, a very poor lifestyle, diet is not healthy, choices of a lot of treatment can kill the good gut microbiota. This will lead to the dysbiosis, and ultimately the individuals will present to many GI symptoms from diarrhea, constipation, bloatedness, flatulence, and many of them in fact will go to your pharmacy and asking, is there anything that I can take to reduce all this symptomatology? And of course it will lead to many phenomenon, apathy, mental health issues, and worsen the non-communicable diseases, for example diabetes, and of course digestion status and immune system also must reduce. Now, we all encourage people or individuals in the clinic or in the pharmacy or anywhere to take the good fiber diet, but we know that as a Malaysian, if you look at the literature, we are among the worst community to take the fiber diet. So in general, the recommended daily allowance about 20 grams per day. So average Malaysian is about 8 to 10 grams, which is barely half, and that's the reason why colon cancer is number 1 for males and number 2 for female in Malaysia, simply because a lack of fiber diet. And of course, supplement with probiotics, not provide the 100%, but something that we can offer to healthcare customers. Now, this leads to the definition, what is a probiotics? It's basically, it's a live microorganism that we take and can provide in the appropriate dose, appropriate targeting specific illness based on the science, and it can confer and provide some relief or benefit to that condition if we appropriately take that, not just simply for supplement, making you, we call it shock syndrome or placebo effect, you feel much better, but in fact maybe because you exercise more than usual or your diet has changed for the last couple of months. So we really need to do something about it. So if I Google probiotics, put probiotic in Malaysia, well, there are so many. I pretend to be healthcare customer many times, go to many pharmacies. I say that I got some bloated, can you suggest to me probiotics? So I will got different 10, 20 different answers. I don't want to say which pharmacies. And I say, why you suggest to me A? Why B? You know, what the evidence that you have. As a customer, I will go to the formulation. I will go to how easy to store. Is it in the fridge? Is it -20? Is it on the shelf? Whether the capsule, powder, and more importantly, the cost. Because I do not want to add another 400 or 500 per month on my monthly bill on the top of anti-diabetic, anti-hypertension, dyslipidemia, blah, blah, blah. So I think we have to give justice to the healthcare customers on the science of the probiotics. So there are many. You can search a very fantastic multicolors probiotics. Sometimes you get migraine, to go to choose which one is the best one. And to date, there are 260 plus different type of probiotics found, whether commercial name, whether species name, or microorganism, subject to the discussion. And the challenges for me, and of course for you as well, how do we advise our patient for good probiotics that benefit to him or her? I mean, we have to be fair in the current economic climate. Is it based on the quality? Is it based on claims, or you want to clear the stock, or is it what? I think we have to be very vigilant on that. And I think I'm going to give you the clue, the choose whatever available on the science, and of course, do not assume all probiotics are the same. Okay, they are not the same. Probiotic A, B, and C is like you have the beta blocker to dispense to your patient, propranolol or timolol or atenolol. There are varies between the biological half-life, and then mechanism action slightly different, and of course the dosage so and so. So the same principle for the probiotics. So there are about 10 or 11, I would say, the properties that we have to consider before we offer to healthcare customers. Right strain, quality is very important. It doesn't mean that the most expensive the better. Whether the sugar level is high or low. We all know in Malaysia, 1 in 3 or 1 in 4 pre-diabetic already. What are the clinical evidence based on the randomized clinical trial or systematic review for the usefulness of probiotics? Is it in the food or in supplement? Or who manufactured that? Is it certified GMP or not? And how is probiotic actually link tackles to specific disorders or illness of the individual? This is among very important, and of course regulatory bodies, mode of action, a balance between efficacy and safety, may not involve DDI, drug-drug interaction, but also to some degree may involve the pharmacokinetic, dynamic, genomic of certain drugs that co-taking together, and of course, choosing very quality products. Now, these are the basic things I want to show to you when you see on the box, let's say among the commonest, Lactobacillus amphiphilobacterium. Lactobacillus is a genus, Acidophilus is species, and there are various, let's say this one, BCMC Bio1230 is a strain. And for the last, I say 7 or 8 years or so, a lot of data show that multi-strain probiotics perhaps more effective than single strain in many conditions because provide a wider interaction or modulation in the intestinal environment. Quality, again, we use a CFU as opposed to milligram, nanogram. You supply a troxin 50 microgram. So for probiotic, because CFU, colony form unit, in general is about 10 to 20 billion CFU. Sounds like very high, but it's actually the normal dose and good quality. And is it more, the more the probiotic dose, the better? Not necessarily. Depends on what are you targeting the symptom to alleviate from the healthcare customers. And of course, you have to be very careful. A lot of a probiotic actually, by the time they swallow, 80% will be dead in the stomach because of acidic environment. So what's the point of taking that probiotics where 90% is gone and it doesn't reach to the middle or small bowel or the large bowel over the time? Of course, the quality is a study very quickly to show you that taking the Hexabio, even after 12 weeks or so, you still have a degree of the probiotic, in this case like the Bacillus amphiphilobacterium, suggesting that this bacteria can pass the GI tract, even though in the acidic environment, they're still viable, so that it will be indicating the usefulness of taking these probiotics. Allergenous sugar level, something that we may need to we must consider in the setting of very high prevalence of the metabolic syndrome in Malaysia, in Asia in particular, type 2 diabetes, so and so. I think we don't want to alleviate or make diabetes worsen among the healthcare customers, and also dyslipidemia and other metabolic parameters. Now, it's quite important that a lot of customers will say that, oh, I take from the food, from the supplement, but when you compare that as a supplement as opposed to food, we cannot quantify the dose, we don't know what species, we don't know where they're coming from, how much sugar in that, so we cannot actually rely on that, on the food that they take as opposed to provide a supplement for the daily consumption. Of course, manufacture is very important. I think the companies or whatever the industry has to be certified by the good manufacturing practice, GMP, to ensure the quality of the product. Packaging, storing, the expiry date, and final formulation is very important. We may not like this one, but this is very important aspect by the time we go to NPRA and registration of MOS and things like that. And above all, what are the clinical evidences that we should use this probiotic A as opposed to B in certain conditions. So you can't just simply to clear your stock or to give this probiotic coming from Japan, Australia, you think better, but you need to be justice. Why is this probiotic has underwent clinically tested in various disorders for whatever condition or symptom that you want to alleviate for the patient. Now, there are hundreds of randomized clinical trials in different diseases from inflammation to cancer. Data is conflicting, so we have to really judge. Again, critically appraise, reading the paper is very important, rather than reading the abstract, whether which condition that we should use. These are the well-established microbiota diseases. In particular, you will remember that if your patient that you prescribe antibiotics for UTI, urinary infection, many of them, especially in elderly population, they tend to get antibiotic-associated diarrhea. So in my practice, quite common, people who are 50 or 55 and above, that complain of diarrhea after especially augmented 625 milligram BD. So you can give the same probiotic within 7 to 10 days to alleviate the symptom, so that the compliance, the adherence can be achieved, and the treatment can, and the disease can be completely treated. And of course, many other diseases can be Helicobacter pylori, because we use a lot of two antibiotics, and PPI also can predispose patient to the diarrhea. And there are many diseases on the board now, that the one that involving using probiotics, in particular my research interest in the fatty liver, various metabolic syndrome, diabetes, colon cancer, and also irritable bowel syndrome, and this patient coming to a lot of pharmacies. And again, the key point is to choose probiotics that underwent randomized trials, and what are the recommendations. So there are many probiotics that can be used either as a prophylactic or prevention or therapeutic purposes, depending what are diseases or disorders that you want to target of these healthcare customers. We also did some consensus statement in Southeast Asia about how to educate the individuals in terms of choosing the quantity and quality of the probiotics. I'm not going to go through here. If you are interested, you can go back to read this. These are free, and ranging from the same question, are the probiotics the same or not, and are there any use for obesity, and we gather all the data in terms of using the probiotics, and we make a consensus based on the clinical evidence, whether is this a placebo effect or is it a good therapeutic property. Now, if I'm meant to say a bit about Hexabio, which is a combination of 3 species of lactobacillus and also 3 species of the bifidobacterium, what have we done in terms of clinical studies that we do several clinical data. So this is MCP, microbiome cell preparation, 30 billion cells, and in terms of powder. And we have done several studies about this in terms of administration. Usually, in my practice, I give a sachet twice a day for adults or elderly population. For children or young child, I give a sachet a day, mostly for the viral gastroenteritis. So, let's just go speed up here a little bit here. So, these are the typical indications that we do in practice. Diarrhea, in particular antibiotic, such as the diarrhea or acute gastroenteritis, or anyone that come into the pharmacy get this. Yes, you give anti-diarrhea medication, but if you give probiotics, you actually can save 3 days. 3 days faster to get the diarrhea resolved from not taking probiotics in the diarrhea-associated or antibiotic-associated, and many others, adjunct therapy in non-communicable diseases and even cancer. So allow me to go to the gut health, several diseases. There are a lot of studies that we've done. This is a colleague from University of Malaya, where we do the randomized clinical trial looking at improved chronic constipation. As you can see, that consumption of the Hexabio will actually increase the stool frequency and improvement of the constipation symptom among the patients who are chronic disorders or ill with many other diseases. I also did a study with Dr. Hayati Yaakob looking the multiple chronic comorbidities among elderly patients, and indeed giving them about 6 weeks supply. What a relief for them having the stool, that blister stool with constipated, to the more loose stool, so increment of the 50% of stool frequency and reduce 70% of the constipation. I also did study with Dr. Prof. Nolina, neurologist, Parkinson patient or elderly get motility issues, they tend to get constipation. This, you don't want to do more invasive investigation, colonoscopy, to alleviate the symptom, giving the probiotic, placebo, probiotic Hexabio actually reduce a lot of transit time and improving constipation among them. So how this work actually? Quite straightforward. The MCP binding these TGR5 receptors, causing the influx of the water, stimulate the bowel movement, and relieve the defecation. It's a very straightforward scientific management or the mechanism. And also, these are the typical, if the mother bring the child or asking whether the child has the diseases, the acute viral gastroenteritis. As I said to you, when you're giving probiotics, you get 4 days as opposed to 7 days compared to as bloody or ORS to get the shorter duration of the diarrhea with the probiotics. What about the immune system? Well, again, this is a study done by colleagues in the University of Malaya, enteral feeding in the clinically ill patient. As you can see here, taking the hexabio improve the feeding intolerance in intensive care setting, and not only that, the stay or hospital stay or ICU stay much earlier, about 1/3 of the patient consuming that. Patients with colorectal cancer also been proven that giving probiotics, they have nutrients absorption, calorie intake much faster, and reduction of the hospital stay. Now, what about the markers for the patient with colon cancer among the commonest cancer? So, hexabio also have interesting properties, bringing down interleukin-6, which is a very important markers, which is bring down the inflammatory process, and the chances of recurrence of cancer also much reduced. And I did the study here, my PhD student, a randomized trial again, giving the patient with colon cancer and giving the 6-month supply. You can see the marker of the inflammatory cytokine after 6 months is a lot reduced. And that surprised us completely with a 6-month supply of the probiotic, suggesting to us that can alleviate the recurrence in the future. And in fact, more than 60% of the reduction of the pro-inflammatory cytokine. Metabolic issues, again, Prof. Noazmi and colleagues of mine, again, giving the options of the probiotic also has some degree of reduction of the HbA1c, fasting insulin level, and this as a result because of less sugar, better control of diabetes, and again, it also can reduce the serum urea level and preventing the chronic disease occurring. Now, this is again Zubaida, my PhD student, also specifically recruited post-gestational diabetes woman. So the woman who get diabetes during pregnancy follow you in your clinic. 50 to 70% will develop full-blown diabetes. By giving probiotics, we have seen the reduction of fasting blood sugars, HbA1c, and of course inflammation markers also reduced. In terms of fatty liver, we have do a lot of good science, and we can see the reduction of the expression of some markers, CD8, suggesting that probiotic also can protect intestinal permeability or leaky gut, so to speak, in the patient with fatty liver, and indeed it can cause the stabilizing immune system, preventing the intestinal permeability becoming leaky. And in fact, there's a reduction, you can see there with the supplement probiotics, the stabilized many markers, in this case we do the tight junction protein, the zonulin-1 actually much preserved. And of course, we also have a master student look at the using the probiotic, actually restoring the balancing or composition of gut microbiota,